Shimon, so with a lot of people that have salt rooms or salt booths and such, and people are asking questions about, somebody could be asymptomatic going into a salt booth, and they're in a salt, booth breathing, or they're in a salt room. What is some of the protocols of? Should there be anything different that people are doing, or what are we suggesting here?
Well, keep in mind that a lot of what Braden is talking about is with regards to surfaces. So viruses landing on salt surfaces, and salt booths and other salt rooms where you have chairs or the wood from the walls, you should still clean them or disinfect them as normal, because the virus will be landing on the wood and not on the salt. With regards to salt on the floor, it does seem that the studies and the research that he's been doing does indicate that the salt will handle those viruses.
Yeah. Well, and then the other thing too, a lot of people are, so basically if somebody's in a salt booth or salt room, they should still follow the same protocols with taking their disinfectant, rubbing their surfaces all over, and doing the same thing. Right?
Yeah, so when disinfecting surfaces, always follow the CDC's guideline, and they have specific disinfectants. It's pretty much any disinfectant will handle it or close to that. So always, don't rely just because there's salt in there that you don't have to clean your booth. You do want to clean it. But it does help a lot with surfaces that are salt surfaces that you can't really use a water-based solution on to clean it. This research does help.
Yeah, and I know some people have asked about UV lights in general. So can you just comment a little bit from the technical side about what's going on with people, based on what we're hearing, UV light may not provide any more protection as long as if you're just cleaning the surfaces with disinfectant.
Right. So UV, and specifically, like you said, UVC, does kill viruses. It does have to be a specific wavelength that's considered the UVC, which is, as we mentioned in our previous call, it's very dangerous for human exposure. When using it, people are using it, I see, in two different ways. One is upper ear disinfection. They're shining it above people's heads, basically, and to kill viruses suspended in the air above people's heads where it's not exposed to people. The other way is I've seen a lot of products being advertised that they're advertising UVC wands or lights for people to go around and expose surfaces to. In order for that to work in a salt room, you would have to expose it to a specific length of time and from a specific distance. And the surfaces do have to be clean, because if you're shining it on a surface that's covered in a layer of salt, the UVC won't reach the actual surface you're trying to disinfect. So when doing that, regardless of course, the health concerns and figuring out how to protect yourself while you're walking around with this UVC light, you still have to clean salt off your surfaces in order to use it to disinfect surfaces. So I would suggest just using the CDC approved disinfectants and cleaning the surfaces just standard, instead of cleaning it and then also going over it with UVC.